Aloha everyone out there. I am actually doing a presentation for nurses on Friday, and I just had to revise my story of survival, and I didn't know if you would mind listening to tell me some feedback on if you learned anything from my story. I don't mean to say so I'm going to try to stop saying I'm noticing I'm doing that as well. Once again, my name is Sayla Hashi. I have a lot of friends on Twitter. Hi, everyone. And I just wanted to share my latest version of my survival story with you. So thank you for being here. My name is Sayla Hashi, and it's really hard to kill me. And since 2017, I have served my community of ovarian cancer survivors in many ways, including as an advocate leader, a consumer reviewer, and as a survivors teaching students program presenter. I'm grateful to be here with you all, or anywhere for that matter. Ovarian cancer has taken a lot from me. Most painfully, it has taken my fertility. But ovarian cancer has also given me a mission and the resolve to share my story, because if I can save just one other woman, my own experience will at least feel worthwhile. My husband and I have always wanted to have children, so we visited our fertility doctor. The year was 2017. He sent me to do a pap smear with my primary doctor as part of our initial testing. It was my 37th birthday when we got the call that the pap results showed ovarian cancer cells on my cervix, and I would need to be seen by a gynecologic oncologist, otherwise known as a gynoc, ASAP. We had previously ordered an ultrasound, and we put in the request for a CT scan. I was in shock. I later learned that you could not be diagnosed for ovarian cancer without a biopsy. I then met with my new gynoc. He wanted to rule out cervical cancer, so we did a procedure called a cone biopsy, which confirmed I did not have cervical cancer. Next, we were scheduled to do a biopsy of one of my ovaries and one of my fallopian tubes. When my gynoc and his team opened me up abdominally from my pelvis to above my belly button, they did the biopsy and discovered I had stage 3C low-grade serous ovarian cancer. They then performed a lengthy debulking after speaking to my family because I was unconscious, which then sent me into early menopause and saved my life. After my recovery from surgery and my adjustment to surgical menopause, it was then recommended by the tumor board that I start IV chemotherapy. I learned that low-grade ovarian cancer doesn't typically respond well to chemotherapy, so I decided to seek out a second opinion from one of the top low-grade serous ovarian cancer doctors at MD Anderson. He let me know that some patients were having luck with letrozole, a maintenance drug. Some patients did chemotherapy, some did partial chemotherapy, and some went straight on the drug after tumor debulking. I decided to skip chemotherapy and go straight on letrozole. Less than 6 months went by before I had muscle strain pain in my abdomen and extreme fatigue. My gynoc ordered a CA-125 blood test and a CT scan and did a physical exam. All 3 tests confirmed a recurrence, which sent me back to the operating table, saving my life yet again. In my opinion, it is important for everyone to know ovarian cancer symptoms and risk factors. I had symptoms of ovarian cancer prior to my diagnosis. If I had known then what I know now, I would have asked for a CT scan when I first experienced symptoms of frequent urination, fatigue, bloating, and abdominal pain. I wouldn't have been quiet about my symptoms, nor would I have thought they were a normal part of being a woman. Lots has happened since I wrote my original story back in 2018 for the Survivors Teaching Students program. The most exciting thing is my husband and I moved to Hawaii in December of 2023. In February of 2024, I had the best CT scan of my life. Was it the sun? Was it the ocean? Was it the broccoli seed peels I'd added to my oral chemo regimen? Who knows? Not I. But regardless, I'm grateful. Today, I'm 44 years old and a 7-year survivor of chronic ovarian cancer. I'd had several doctors prematurely try to change my cancer treatment before I moved on to my current medical team. So I'm a big proponent of trusting your gut and getting second opinions. I still have chronic ovarian cancer, but with the help of my medication, iron infusions, and sometimes blood transfusions. And my favorite nurse practitioner, Joanna, I am living a somewhat normal existence. I have a family, hope, love, and joy. And I feel extremely blessed to be here and to be considered stable as of my November CT scan. I don't know what the future holds, and I do have other concerning medical imperfections that I am in the process of being treated for. Yet I have a team and a plan, and I remain optimistic. Does anyone really know for certain what tomorrow will bring? These days I share my life on social media, which has given me a greater sense of purpose, because I have many former strangers rooting for my survival. I am not alone, and neither are you. Stay well, everyone, and thank you for listening to my story. Love you. Bye.